A 40-year-old man presents with worsening fatigue and prolonged history of abdominal pain. Exam shows mucosal pallor and epigastric tenderness on the palpation. His lab values are shown. CT scan of the abdomen shows atrophy of the pancreas with multiple calcifications. A primary impairment in which of the following steps of cobalamin absorption is the most likely cause of this patient's anemia. This patient is presenting with a vitamin B12 deficiency, as we can see from his lab values. He also has elevated MCV, which is going to be consistent with macrocytic anemia due to a vitamin B12 deficiency. When we take a look at his CT scan, it shows atrophy of the pancreas with multiple calcifications. Along with his history, this is going to be consistent with chronic pancreatitis. In chronic pancreatitis, we have a chronic inflammatory process going on in the pancreas that results in calcifications as well as fibrosis of the pancreas. This ultimately results in destruction of the acinar cells of the pancreas. Now, the acinar cells of the pancreas are going to be responsible for producing pancreatic proteases. These pancreatic enzymes are not only important for the absorption of proteins and fats, but they also play a role in vitamin B12 absorption. Remember that vitamin B12 comes from animal sources, and so when we first consume vitamin B12, it is attached to a animal protein. And this B12 animal protein complex is broken down in the stomach when it encounters HCl and pepsin, and this breaks down the complex, resulting in B12 being by itself. Our protein, which is going to be produced in the salivary glands, comes in and binds to B12 when it is by itself, and it forms a R protein B12 complex. This complex then travels to the duodenum, where it is then broken up by pancreatic proteases. And remember that this is where the acinar cells are going to play a role in this process. Acinar cells produce pancreatic proteases, which are responsible for breaking down the R protein B12 complex. This step is important because it allows intrinsic factor to come in and bind to B12. And remember that intrinsic factor is ultimately responsible for the absorption of vitamin B12. And the reason for this is because we have the intrinsic factor B12 receptors found in the terminal ileum, which is going to be responsible for absorbing the B12. So if we have damage to the acinar cells, then we're not going to be able to produce these pancreatic proteases, which are responsible for breaking down the ART protein B12 complex. And as a result, B12 can't be by itself to bind to intrinsic factor and ultimately cause absorption of B12. So to answer the question, the answer choice is going to be answer choice C, which is going to be enzyme-mediated cleavage of cobalamin from our protein. So this step is going to be hindered if we have chronic pancreatitis, which causes damage to the acinar cells of the pancreas.